position of board chair. Is there a motion to close the nominations?
Second.
Motion by Mr. Purcell and seconded by Mr. Heath. All in favor? Anyone opposed?
No. Congratulations.
Dr. Carroll, that was a motion to close the nominations. You need to have a vote on
Okay.
the nominations.
All right. Wait a minute, say that again?
You need to have a vote on the nomination. So
Okay, gotcha.
the action was to close the nomination. You
All right.
still have to get a majority vote in favor of it.
Is there a motion to approve the nomination of Mr. Overton for the position of board
No,
chair?
you just need a vote. You already have a motion and a second on his nomination. You just need to vote on that nomination.
Okay, wait a minute. Then don't we need to vote to close the nomination?
You just did. That's what you did.
See, this is why I'm not nominated for
You're
board
doing
chair.
You're doing
Okay.
a great job.
All right, so the motion for Mr. Overton as board chair was made by Mr. Purcell and seconded by Mr. Heath. All in favor? All opposed? Any opposed? Okay, congratulations to Mr. Overton on his appointment. All right, now, so I'm going to try to do this right since Anita provided me with a script. So the next position to be decided is board vice chair, and the floor is open for nominations.
I nominate Jason Banks.
Second.
Are there any other nominations for vice chair? All right, seeing there are no other nominations for the position of board vice chair, is there a motion to close the nominations?
Motion to close the nominations.
So motion made by Mr. Purcell,
Second.
seconded by Ms. Idlet. All in favor?
Aye.
Any opposed? All right. Is there a motion to approve the nomination of Dr. Banks for the position of vice chair?
You have that motion. You just need to vote.
That's what you, so it's your fault. You all, yeah. Yeah.
We'll take the blame.
Okay, all right. So we
Everybody
have
else
that
is
motion by
waiting
Mr.
for
Purcell, seconded by, okay, by Ms. Idlet, right?
Right, we closed the nomination, now we just need to actually vote on Jason.
Yes, I still think it's your fault. All right, so all in favor? All in favor?
Aye.
All right, any opposed? All right, congratulations to Dr. Banks on his appointment as the board's vice chair.
Congratulations, Jason.
Thank you. Congratulations. Yeah, thank you. It sounds like y'all had that plan.
We didn't actually.
We did.
We hadn't discussed it
And
at all.
discussed.
Just fell right into place.
So we'll continue on with our agenda. Is there any consideration for open session agenda changes?
Chairman, I'd like to have an item under the action agenda to update and discuss that policy for this month.
Okay. That'd be action item A. Any other consideration of changes? Seeing none, I entertain a motion to approve the agenda as amended.
Motion.
Motion by Dr. Banks to approve the December 6, 2021 meeting agenda as amended. Seconded by Mr. Purcell. Is there any further discussion? All in favor say aye. Opposed? Motion carries. I'd like to ask everyone to please take a moment of silence. Thank you. I have the Pledge of Allegiance. Flag is behind us.
I pledge allegiance to the flag of the United States of America, and to the republic of which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you.
Consent agenda.
Motion.
Motion by Ms. Abbott to approve the consent agenda.
Second.
Seconded by Mr. Heath. Is there any further discussion? All in favor say aye.
Aye.
Opposed? Motion carries. Information Updates, Almar Regional Health Services Session. Mr. Betts, Health Director of ARHS.
Good morning.
Good morning.
Good morning.
Dr. Carroll asked me to be here this morning to answer any questions you all may have about COVID and I think according to the agenda, maybe specific questions about the MOU we recently entered into and just any other general updates about the pandemic. So I'm happy to do that for you this morning.
I guess I'll start. Specifically with the MOU and how it relates to the ELC document, and basically our agreement between our organizations. Can you help explain some history of how the which government entity originated this program and how it developed as far as where the directives came from, maybe federal to state to ARHS, like where the actual MOU was drawn from?
Okay. Well, ELC is really enhancing lab capabilities, and that comes down from the federal level. We've had that money since about midway through the pandemic to kind of help get our capacity a little stronger than what it was, so we could respond a little more with a little bit more, be a little more nimble, so to speak, to try to respond to the community. This next batch of funding that came through the federal level through ELC was just another attempt to continue to build that local capacity. And I believe the specific amount of money the pot that you're talking about, Alabama Regional got about $1 million for that. And so with the guidelines, I could have hired a local nurse, hired them for a year, 18 months, and then I would have been in a position to have to let them go after that funding was basically expired, had run out. So I asked the state for special permission because, to me, the experts are already here. They're already here on the ground. The nurses are already doing that work. So, I mean, it's just, taxpayer dollar is a taxpayer dollar. And so my goal with that was, why not go ahead and let us use that funding to pay folks that are already doing the work anyway. So that's really where that derived from. And of course, the MOU really is just language directly out of the agreement addendum that comes from the federal government to the state government to us. As long as we're meeting that assurance for them through the arrangement with you guys, I'm fine. I think it's a good way to save local tax dollars. So I appreciate y'all doing that.
As far as the development of the MOU from ARHS, was that handed down from North Carolina DHHS?
The MOU, the AA that we get from the state has certain criteria. And so anything that we enter into has to match that. And to the state's point, the state AAs have to match their federal guidance. So it's a trickle down effect.
Our system and everyone else has already accepted and used CARES Act funding. The terms and conditions listed in the ELC document that we referenced fall under the same umbrella as CARES and other federal programs such as PPP, Healthcare Enhancement Act, Coronavirus Preparedness and Response Supplemental Provisions or Supplemental Appropriations Act, and the American Rescue Plan of 2021. The ELC is the directive from the federal to state level. Same, just different pots of money, correct? All those different bills were federal programs. And once again, the money trickles down from federal level to state to localities.
Right.
So,
all the ones you just listed are federal pots at the large level. They pass down to the state. The state makes various adjustments, I'll say, or enhancements to whatever they would like to see within DHHS. And then that comes down to us at the local level.
In the ELC document, it says the 85% of awarded funds referenced in the state award, or what was awarded to the state and how it was to be used, such as testing, vaccinations, and all kind of different things. The 85% referenced in the ELC document, that is from the federal level to the state level, not
the 85% of the $100,000 that is part of our MOU.
Oh, Lord,
correct?
yes, you're exactly right. Yeah, and ELC, when they're using that language, they're talking about all the money
Yes.
that they've distributed
Okay.
from the federal level on down. So this little bit we did is just small potatoes, not, that $100,000. I mean, that's small potatoes in the grand scheme of everything that they've got going on. Again,
We're not gonna have 85,000 of that 100,000 is not to be spent on testing, vaccines, guidance.
No.
Okay.
I mean, it's literally for nursing, to support your nurses if they need a new computer, if they need some type of specific training. It's literally for your use. I mean, it's for your use to support these efforts, which you're already doing. So to me, it was just kind of that one was the easy one.
Yeah.
Out of all the things we've got going on, this one was pretty easy.
But I mean, like I said, the way I read the 85%, I think some people might have been concerned it would pertain to the 85% that we received. It was 85% of the federal level of funds.
Yeah, I appreciate the clarifying question. No, it is, the 85% is their federal mandate across all the billions, quite frankly. They're spending on all of that. So, yeah.
Okay. In the MOU, in the department agrees section, item 6, that it will complete a COVID-19 response plan related to local health departments' broader goals and partnerships with COVID-19 preparedness and response. Can you explain what those broader goals and preparedness and response from your local position? Because once again, that's language passed down from the federal level. What is it on our local level?
Right. Well, all the pots that you mentioned earlier, thank you for doing that. So I don't have to stand here and recall. All of those require interwoven COVID response plan. And so what the state's done is only required us to have one. We can have one of those, and then we can weave that into all of the other 6 different pots of money. So really what that's doing is making sure that we have the right linkages with our emergency managers, county managers, law enforcement, all those things that we do that well anyway because we're a regional model. So we've got a lot of those relationships in place. There are some places that do not. So again, it's just that one wasn't a heavy lift for us really because we had preparedness plans in place since 9/11, quite frankly. And so we've really utilized those 9/11 response plans to prepare us for with the journey we've been on for the last 24 months. So we really just utilized a lot of those. It's a lot of communication type things, just making sure we keep each other educated and informed and that kind of thing. So it's really just one plan, but that goes across the CARES, the ARPA, ELC, all of those.
In the MOU, again, the LEA agrees section, section 3-C, school site vaccine administration, item 1, provide vaccine information and encourage on-site opportunities. Can you characterize the provide and encourage language in this clause? Does it mean indirect or direct advertisement or dispensing of information related to vaccination to students without the school or the board approval?
Now you control your own messaging on that front. That's what this group is designed for, quite frankly.
Just trying to make sure we're clear that ARHS is not going to strongly encourage or require that the school distribute advertisements about vaccination or even COVID in general to the student population without our knowledge. Or
What was explained to us when Ms. Fair came into her presentation was that part of it, and we're just wanting to clarify it because we've had concerns brought to us, so we want to make sure everybody's on the same page. That the vaccine information was the VIF sheets that are given out if we were to hold a vaccination clinic. Not that ARHS is going to come in and just at all randomly just push information out to students and staff about COVID and about everything else. I understand concerns were brought, so we're trying to make sure everybody's understanding the exact same language that we're all talking about the same thing.
We're happy. Part of the public health mission is to educate and inform our community. So we're happy to do that anyway. We're invited to, or we're able to. We're certainly not going to try to impose any type of
being invited or asked to
right
by the board or the
right. I mean, we're not going to come and anyway. Yeah, I hope that answers your question.
I'm hoping
hoping the OSHA portion of this is behind us, but in the MOU, the LEA agrees section 3, D, OSHA compliance program. If OSHA had not suspended the vaccine mandate, what would have been the role of ARHS as it relates to vaccination of school staff? Would there have been any participation of the health department, non-requested? Should OSHA have required vaccination for our staff?
You said non-requested?
Yes.
Non-requested, no, I'm not going to go anywhere. I'm not going to come in and, I mean, if you all, again, I'm a little confused by some of this because this is your role. That's your thing. My purvey is in a separate arena. So whatever, if you decide to do something for your employees and your staff, that's within your control. If you decided to do that and we could assist you in that way, we'd be more than happy to do so. If you did not, we wouldn't really have any stake in that. That's solely your decision.
A lot of my questions is to make sure the public understands a well-defined boundary between ARHS and Camden County School System and any other school system, really, I guess, for that matter. But
the only way a public health director can intervene in anything within the school realm, just to keep, I don't know how, the only thing I can do as a public health director if something was declared an imminent public health hazard. And that would be my only ability to take any action through general statute.
And that would be passed down from federal and state.
Well, no, that's still local. If you had some type of, some kind of a outbreak or some kind of a really just a way out there thing, if something happened and we had to intervene, we do have the ability to do so. But other than that, no, I mean, that's it.
In that same section 3-I, it says the school health liaison would be available to assist during a public health emergency. Again, I would assume that's probably one of those big, humongous events like you were just kind of describing. But that would only be the school health liaison, not the other nurses. How would that work if we use the funds to pay one of our school nurses? I mean, would that school nurse be required to assist ARHS with a public health emergency?
That particular clause is in there. We have what's called a sniffy, what we call sniffy nurses, school health nurse initiative funds. We've had those for decades. And that wording is in there similar to that. So like a hurricane, what that's speaking to is like hurricane response or things of that nature. So if we had to set up a shelter or something like that. So any nurse that participates in those sniffy funds, and we have said these funds as well, if we had some kind of a hurricane, tornado or something like that, we would ask them to, and again, we would ask them to participate in supporting those efforts. And that's usually on a temporary basis. Our folks will go in as the first line when we stand up the shelters. And then we ask our school folks to take that second shift. And again, that's not anything new. That's been around for decades. We've always had those arrangements in place. And then of course the cavalry comes in with the Red Cross, hopefully at some point, for shift 3 or 4, depending on how far down the road we end up having to go with any particular event.
Okay.
Excuse me, the key word you said was ask. You didn't
Right.
say shall, you didn't say required, you said ask. So
Right.
that person that's unavailable, maybe they have other emergency needs or families they need to take care of. It's not a mandate.
Right. We try to work with folks as much as possible. I mean, we have had the random thing where, we've asked them, can you help? Well, no, I can't. I've got to go do X, Y, or Z. And then 2 or 3 days later, well, no, I've got to go do X, Y, or Z. And so, in those situations where we've tried to make repeated efforts in good faith, and we feel like the schools try to make good efforts in faith, we have a conversation afterwards. Maybe we look and see, maybe there's another staff member that's got a little bit more flexibility in their schedule where they would be able to do that in the future or something along those lines. But certainly, again, the last thing I want is to have somebody disgruntled trying to help folks, vulnerable people in a storm shelter trying to survive the next 3 or 4 days, you need people there that are willing to serve. Yeah. So, I mean, we're trying to, we try to be reasonable and all that. So I appreciate you bringing out that clarification.
And I'm sorry if a lot of these questions I think we're hitting on a lot of the same subject matter, but number 2 at the top of page 3, liaison may also work with health department on contact tracing and assist with mass school vaccination sites if indicated. Once again, I mean, does this MOU change anything with our current contact tracing protocols that are held within our school system, or vaccination efforts within our school system?
None. Again, that's why I thought it was a home run. And again, I'm so sorry y'all have had to deal with all this, because I really thought this was in the grand scheme of everything we've been dealing with, this is probably the lowest level, smallest potatoes of anything I've dealt with so far. I mean, to me, so I apologize y'all have had to deal with it to this level, because again, so that sentence, contact tracing and CI, investigation and tracing, nurses have been doing it for 2 years. They've been doing it. They're getting it done. They're the ones that are doing it. If we needed assistance with vaccinating anyone, staff, students, whatever, support staff, whatever, they've been there to help us with some of the community events. They've been there to help us. That's all that's saying. It's just acknowledging that they've been there to help us. And, if they can, they will.
I mean, a lot of this comes at a time when, the federal government's pushing vaccination requirements and mandates. And I know, with my own kids, I don't mind doing vaccinations on a volunteer basis, if I get to choose what vaccines my children have. But the concern is that eventually it's going to get pushed down and pushed down and pushed down until, a COVID vaccine is required for students. I think myself and everybody, a lot of other folks are just concerned that this could be the first step down a slippery slope.
And it's not so much brought here, for you to apologize for us having to deal. We don't mind dealing with it, because that's what these people sitting in the audience, the staff members, the parents, the children have asked us to do when they elected us. So we're wanting to make sure we're getting the information they have asked for. It's not, we're not mad about it. We're not, you didn't do it. It's not confrontational. We just want to make sure on the record that we get all these things that they've asked us to check on cleared up, to make sure that their concerns are satisfied, because that's, again, what they, when they elect us, that's what they paid us to do, is take their concerns up to wherever it needs to be to get answered. So it's not, it's not a dig at you or A or us. It's just the people who asked us to sit here have asked us to make sure that everybody's understanding all this confusing terminology that's in some of these documents. So.
Certainly. And anything about the mandate, or I can't speak to what DPI will do or what the federal level will do as far as what I would say, like the official list of what those required school age vaccines are. I can't predict what that is or what that will be. What I've been advocating for since like the last of August or 1st of September is an end game, quite frankly. I'm asking the secretary, I'm asking all of them, what is the end game? Where are the goalposts? Let's stop moving the goalposts. Where are we going? I see this tracking a lot like flu, the seasonal flu. Moderna is working on a product right now that's a dual platform. It will be a combination of a flu shot and their best guess at what the flu strain is in a year, and then what the latest iteration or a variant of COVID is, into a dual platform product that'll probably be available next year. Certainly not where we are now. But I do see, some need to a move of syndromic surveillance where we don't necessarily count every single case. We're vacillating between 200, 250 cases a week right now. Yeah. Is that good or is it bad? I don't know. I don't know what's considered good or bad, to be honest with you. I will say there are other communicable diseases. We're getting to the point from a syndromic surveillance standpoint. There are other communicable diseases that are just as prevalent as COVID in some of our communities. So, I think there's probably a time to acknowledge that and try to have some type of path forward. So, again, like I was saying, in late August or early September, you've got Panther Stadium packed with 80,000 people for 4 consecutive days for those games, for college football games. And I'm all for it. Let's get back to go. So I want normalcy. But then we're expected to go back and tell everybody to go mask up, protect themselves. And we do need to do those things, but it does send, in my opinion, it sends a very mixed message. So it's okay to go to the football game on Saturday, but all those people don't live in Charlotte or Raleigh or wherever they are. They're coming back home to Camden County, Currituck on the other side of you, Pasquotank on the other side of you. So, it's just trying to keep things realistic. It's kind of where I am with it.
All right, couple more just very
Sure.
simple yes, no type questions. And once again, kind of hitting on the same stuff, but will ARH under this agreement or otherwise, barring any kind of federal things you don't have control of, require or force testing and or vaccination of staff?
No, again, that's your call.
Question as far as students go.
Nope, I would say that's your call. That's probably not going to be your call. That'll be somebody, like I say, DPI or CDC or any of those folks, but it certainly wouldn't be mine.
I greatly appreciate your time and
Okay.
being willing to stand in front of us.
I'm sorry.
Oh, no, you go
Let
ahead.
him go, just to clarify the wording in the MOU. At any point, for cause, for not cause, this MOU can be terminated by either party, 30 days notice, and it's done, correct? There's nothing
Absolutely.
hidden. Yeah, okay.
Absolutely, yes. Any for whatever.
For cause or for no
for
cause. at
whatever
all.
reason
Just-
at all you decided, or we decided for whatever reason, again, it was really just a way we had, it was $1 million that I could put back into our local communities to offset local tax dollars. So you could pay for something for the band or the football team or the science department or the English department, whatever. I know how precious tax dollars are. That was my only intent with any of this, not to stir up everybody, get everybody upset. It was literally just a way, your nurses were already doing all this work anyway. And so why would I need to go hire a nurse on a temporary basis when we've already got all that expertise out there? So that was my only intent.
As far as giving a vaccine to a student, you can't do that without parent consent. Is that right?
Oh, absolutely not. Yeah, we never would. We cannot do that. Would never do that. Absolutely not.
Thank you.
Oh, sure. And on the masking front, I know you didn't directly ask this, but I know there's lots of discussion back and forth and all that mask, not to mask, that kind of thing. Again, I'm hearing that there is hopefully going to be a move to more of a syndromic approach. The state's saying the 1st of February. I'm really advocating for. I could see middle of January, quite frankly, because if you get to the point where you call it first semester or second 9 weeks, every system is different. But to me, if we've gotten through the Thanksgiving holiday, you get through the Christmas holiday, New Year's, and then you're post 14 days upon return to school after the holidays, and we're still at a pretty level situation. To me, I really feel like we can try to move back to some sense of normalcy at that point. That would be my hope. I had some similar conversations with Perquimans County, Tanya over in Perquimans, and then Mike Sasser over in Chowan. Talked to him on Saturday. And so, we're so close to the end of the 9 weeks or the holidays or whatnot. That would just be, you didn't ask me for that, but I've just had some similar conversations with some other groups. We're so close to the holidays. I'm hopeful that, the next few weeks with this Omicron variant, we're going to be very, very telling as far as, transmissibility and case numbers and all those kinds of things. But again, you have to take all that with a grain of salt because you've got so many of these home test kits and all those things that are available now. So to me, again, my communication back with the state, some of these things kind of went out the window because I have an active case count in Camden of 22. But how accurate is that number? I don't know because there's so many home tests. There's so many other things that are going on and all that. That came down from the federal level. So, I mean, I know we have 22 cases, but we could potentially have more because of all the home testing and that kind of thing. But again, it's hard to really get a true accurate picture of what the actual case count is. And that's why I'm for moving beyond counting each individual case and putting so much stock into that, because again, the state toolkit, they're measuring your rate per 100,000 Not a good measure for Camden County. It's not really, or any small rural county. I keep beating that drum. And then percent positive. And my argument with percent positive is percent positive of what? You can go line up 1,000 people you know are negative, and that's going to impact your percent positive rate. They've got to look at more than just those two metrics alone, and then just making all the decisions based on those metrics. So anyway, I'll hush unless you've got any other questions.
Any other questions? Mr. Pettis?
Thank you so much for coming.
Thank you for having me.
Appreciate it a lot.
Camden County Education Foundation, Mr. Wayne White.
Good morning. I'm glad y'all were able to see me this morning. Each year, the Camden Education Foundation does a fundraiser. It's called the Phantom Dinner. It's basically, we asked, invite people around the county and even some people outside the county to actually go out, instead of going out to dinner on the 11th of December, stay home and give us the money that you would have spent that night eating supper. So it's been very successful, and it's kind of dipped down obviously through the years, and then we kind of struggled through COVID like everybody. Just like the last fellow was speaking up here, we've all been struggling trying to figure out what to do with COVID and all. And so we've still been able to do this because it's no handing over food and doing the stuff. It's been a fairly safe fundraiser. So I'm just here just that please ask to if you hear anything in the county, if they do call you, because I know as a past board member, we do get phone calls about what's this fundraiser all about or something. If you would, help us and explain that that's what it really is about. It's a campaign to get people to just help us out this way with the deals. And everybody should have got invitation. If you didn't, I got a stack of them here. I'll be glad to hand them to anybody in the room. So anybody be glad. Matter of fact, I'll hand them out. If I can, if not, I'll give them to Anita and let her be sure everybody gets one that's here. But anyway, it's been good. Last year, we really had a fairly successful year. We did $4,500, and so far this year we're up to about $2,750. And actually, date hadn't got here yet, so we're hoping most of the time by the end of the year, up to the first year, we'll get some good donations. And I do appreciate everybody. There's some people who might be in this room that's already given. Thank you. And matter of fact, even this year, I'm going to try to recognize, if nothing but just a little thank you card going out, because I don't want anybody to say, well, I get the money, I didn't hear nothing back. I don't know if they even I even actually got a donor asked me at a ball game the other night, did I get the check? So because they were paranoid about the little envelope and everything. So I'm going to try to do that this year and use that as actually tax, because this is all tax right off. We have our number for the foundation, so you can actually use it for a donation. But anyway, if you have any questions about it, I'd be glad to answer it. And I know y'all have got a whole lot more business to deal with today than me probably, so I appreciate y'all seeing me.
What the money goes toward?
And I brought this up to say, basically what it does is the majority of it goes to, but on our little card it says the foundation scholarships. We have some scholarships we give out, and then also we do the mini grants. So we normally fund 15 to 35 mini grants, cost from $100 to $500 each, with a yearly cost of $5,000 to $9,000. And I know in the past, actually the school has helped us supplant some of the money in the mini grant so we could hopefully meet every request from the teachers throughout the school system. And the scholarships are like the Dennis Bass Knight Scholarship, the Bill Carolina Roper Scholarship, the Brenda Waite Scholarship, Camden Lions Club Scholarship, and the Bartlett Faison Scholarship. I think the Bartlett Faison might have been taken over with another group, but if our foundation still will bring in money for that, I'm supposing, if anybody would like to give to that scholarship. But that's what these monies go to. The majority of this money would probably go to the mini grants. So, and if we have more left over, we'll be glad to look elsewhere and try to give more money. But right now is to help support those mini grants. But I guess that as I answered your question.
Yeah, thank you.
Wayne, you can specify if someone wanted to send money in
Yes.
and be divided up among scholarships, they could
Right,
specify what
exactly.
scholarships or
Is it-
mini grants.
Right. This is not a thing that goes dedicated to the one fund. This goes to the foundation. And if, like I've already had one donor asked to be given to the two specifically to Brenda Waite Scholarship. And I'm looking over at Sally. I guess there is a fund, different funds for the scholarships to donate to, so they can be given to those scholarship funds. So if you have any of those scholarship funds, you can still do it through this. I mean, this is not like some fundraisers is specifically just for this. This is a foundation fundraiser, and hopefully all the money we get, we can satisfy our usually yearly commitments with it, or put it in funds if anybody needs to put it in a special fund of some sort. I hope I've covered everything. I appreciate you coming. I know, y'all got a lot more to do today. Probably y'all don't really need to hear from me unless there's any other scholarship. I mean, there's any questions about the scholarships, I will be glad to try to answer.
I just want to say thank you, Wayne, for everything
Yeah.
you've done for this school
Yeah.
system. It's unbelievable amount
Yeah.
of time you've put into this, from serving on the board to now. with
Well, this has
foundation.
been kind of this whole dinner, I appreciate it, but this whole thing was really, Charlotte Underwood really started the whole foundation Phantom Dinner idea. And of course, she's, like the rest of us, we're getting to the age that maybe we need some help. And I told Charlotte I would take this over. They kind of wanted me to do the president. I said, no, I'll take this over.
I mean, I don't know. I see you several
Every-
mornings
I
too.
see- I see a couple
So,
mornings.
I
I'll
don't
see
know how
them
many of
all.
y'all noticed, but Wayne, he's retired. He's supposed to be enjoying his time. He's getting up early several mornings and picking my kids up at the house, driving a bus for us because we're short staffed on bus side. He does a lot. And as I see him, like I said, 3 days a week, probably in the mornings, picking my kids up at my house.
And I'll be there tomorrow.
Yeah.
I think I'm looking at my boss man by there like,
That's just really appreciated though, because
Yeah.
you've done so much. You do so much.
unless I get over there and he said, you're not driving anymore. Anyway, thank you. But I don't think I'll hear that from anybody unless I do something really bad. I don't think I'll get that done. But anyway, thank you.
Can I get one of those? I don't
Yeah,
think
sure.
I got one. So.
Okay, hey, what is this? If it's okay, can I just go around the table? And I'll just hand one to everybody here. There you go. There you go. That way. Okay, full.
I'll give it to somebody else.
Okay, that's right. If you don't, there you go. Then I think I'm pretty sure you got one, but I see one
Yeah,
number.
I have one on my desk.
There you go.
All right, thank you.
Thank you a lot again. I appreciate it.
Thank you, Wayne.
Thanks, Wayne.
Thank you.
Thank you, Wayne.
Yeah, thank you.
Action agenda, item A, mask mandate discussion.
Mr. Chairman, I'm making a motion that we suspend policy 4120 so that we can act on the mask mandate policy today.
Mr. Purcell's made a motion, it's actually, I looked it up, it's 2420.
2420.
Yeah, suspend
Glad to
policy
hear it.
2420 for the sole purpose of hearing any discussion or making any motions on the mask mandate currently.
Second.
Seconded by Mr. Heath. All in favor, say aye.
Aye.
Opposed? Motion carries.
I think it's somewhat fortuitous for Mr. Betts's comments earlier, because I know myself and I have some of the same feelings that I think we've about hit the point where this is getting done. Testing is coming up, and I by no means think that we need to change anything before testing. It's 1 week away at this point, and then vacation for 2 weeks. We're never going to make green under Cohen or whoever the replacement lady is up there in Raleigh, and that mess show up there, it has given us one case in 2 weeks, and we're out of the green. So it's either we're just gonna have to do it on our own and deal with it. But I agree with what he said, and was already thinking along the same lines as well, that we come back from the holidays, I think it's about time to knock this off.
When is our January meeting?
13th.
The 13th.
Yes, sir.
So they give us like 13 days out of coming back, right? Rough, well, not quite.
We're
Come
back
back
on
on the 5th.
We'll come back on the 5th. So
Yeah.
that'll give us a week. Back from the holiday. I get what he's saying with the the 13 days, whatever it is. Be nice to have a little more data. Guess we can go with what we got at that point.
Make a motion that we go ahead and make mask optional upon return from the Christmas break.
Second. And continue on with the asymptomatic policy as earlier.
So you're saying on the 5th, optional on the 5th.
So we have a motion from Dr. Banks to make mask optional at the return of school for after Christmas break, which will be January
Fifth.
5th. Seconded by Mr. Purcell. Is there any further discussion?
Could you consider waiting for the next board meeting before we did that to see what the numbers look like when we do come back?
It's 2 weeks. I mean, if we're going to see a bump after Thanksgiving, we'll see a bump. And I guess if we need to call an emergency meeting, we'll call an emergency meeting.
We're going to see a bump. We already know it. I mean, it's just going to happen.
It is, but
But our
less children
case-
will be quarantined when we have the bump, if we still have the mask when we come back, and then
Well, under
the
the
2
policy
weeks.
though, if the parents have their child wear the mask and they're asymptomatic, they don't have to quarantine. It's giving the parents back the option of if you want to take that chance.
And
Give them
this
no mask.
gives plenty of time to make sure parents are aware that quarantine is very possible. If you don't want your child to quarantine, then they should wear a mask. If you are a parent and you send your child to school unmasked, you accept the responsibility that that child will be quarantined if they're exposed.
So we're sticking with our same policy.
Everything
Quarantine
stays the same.
policy.
Everything stays the same.
So that could be a strong communication sometime between now and the end of, or before we begin Christmas break, so that everybody's understanding of quarantining.
And I mean, I have had the thought of, if quarantines reach a certain threshold, I think some other districts are doing that, whether it's 10 or I guess most schools are roughly 300. I mean, how many kids per school?
Where, here?
Well, yeah, in each school system or each school, individual school. I know
That
their other
varies.
college is
Yeah,
different.
that varies
High
wide.
school's about 400-ish.
Yeah.
So I'm
So
just-
Grandy has the most.
Yeah.
Yeah.
So right now, we've got like 1 or 2 cases at each school. Quarantines are all less than 10, I believe, at each school. So, even if you've made it like a 10% threshold per individual school to keep quarantines capped off. So if early college or the high school gets up above, or let's say the high school, let's just say if they got 400 students and it gets up to 40 quarantines, and Ms. Davis sends out a message that masks are required for a 2-week period to keep quarantine levels down.
John, is that something we can turn over to do that way, or would we have to have another meeting to
No, you can-
restart it if we hit the threshold?
If the board, approves, Dr. Banks's motion, then, of course, the masks are optional, but that does not deprive the building, administrator of the right to say, everyone's gonna be required to wear one under these circumstances. So any of the principals would still have the ability to do that, particularly deal with these circumstances. If they had guidance from you all that that's what you would want, that would probably help too. But that would be permissible. But that would not be allowed if you didn't change the policy. In other words, the building administrator would have no discretion but to require all students to wear masks at all times. Well, consistent with the policy, under the current policy.
If we went back to optional, I just want to make sure that the principals would have the ability to take that action quickly without having to wait on us to
No, they would.
call a meeting, schedule an emergency meeting, and do everything. If we set a threshold limit for them,
Yeah.
we could.
I want to make sure that I'm clear about this. You're saying that if the board approves Dr. Banks' motion today to make masks optional as of December 5th,
January.
January 5th, I'm sorry, as of January 5th, and a principal says it gets above 10% in their building, they can make
We go-
masks required
We
for
go ahead and set a percentage threshold.
2 weeks or whatever? Okay. I'm processing that, I'm not sure we want to put that responsibility on our principals. I think that maybe the principal could make the announcement, but I think I'd rather take the heat for that, making that decision than them.
Could you just poll us? That's something like that.
And I could absolutely poll the board.
Yeah,
Yeah.
I
It
see what
really-
you're saying.
It
Yeah,
really
it's
be
not.
more of a decision between you and maybe Ms. Lane.
Yeah.
He
I mean, the
just poll
principals
us
can make the
something like-
announcement. I just
Yeah,
don't
so
want them to
I
have
think
to
maybe
be
it
making
wasn't
that
the wording he was
decision.
looking for. He said, yeah, the principals can decide, but I think that's where he was going with it
Yeah.
anyway. The principal would call and say, hey, we've hit 12% quarantine.
Yeah.
I would like to do something. They
Yeah,
would-
I don't
they
want
would
to
use
speak for them,
actually-
but I think they would all happily decline the opportunity to make that decision.
I mean,
Yeah.
these are all numbers that we're already tracking anyway.
Correct.
So it's literally, hey,
Yeah.
we hit this line.
I gotcha. Yeah. I'm okay with the concept. I just feel like it
Don't
probably,
wanna put
I'd rather
that
it
onus
rest
on
on
the
my
principals,
shoulders
right.
for the concerns and calls from parents
Yeah,
than for principals to have to deal with that.
makes sense.
I would be inclined to say that we establish, put it in policy, that way we're consistent.
Mhm. Me
And
too.
it's set for
Mhm.
decisions to be made for staff.
Mhm.
So it's just automatic.
That's
If
right.
we put it in policy though, and we decide it's not a bad number, then we've got to meet again to change it.
True.
If we say we didn't set it high enough.
Well, that's
we
what-
set it too
that's
low,
what I-
too high.
I agree.
If
I
we put it
agree.
in policy, it's
But
got to
what
be
if-
lower.
But what if one person says
Like a website.
5% is too much, and the next
I
person
can
says
get-
3% is too much, and the next person says
I
12%
think
is
our
too much?
highest number
Need
is
to pick a number and
We're
stick
all,
with
we're
it.
all across the board.
50,
not being
and that's
consistent.
Randy.
Except for early college, which is.
Our smallest is 0.
So at the high, so what we're talking about is total enrollment. So if Randy's close to 500 students, I keep throwing 10% out there because, I mean, like I said, right now, our quarantine numbers are all less than 10. And we've only got 1 or 2 cases at each school, if I'm not mistaken. So I'm just thinking, if you set it at 10%, that's 50 quarantines. I mean, that's a pretty high number, but not ridiculous.
Yeah.
Ridiculous.
It's still much lower than where we were weeks
Yes.
1, 2, and 3.
Correct.
Before we would would take action to stop it from getting there again.
But
Yeah.
keep in mind that now you're talking about the masks being off, so the numbers for quarantine are going to rise.
That's right.
Well,
So 50 could happen really quickly in a,
I don't like putting a number on it. I think it should be handled case by case. I mean,
Well, I mean, I'm just, the percentage threshold just keeps us from having to meet to say, hey, let's throw a mask back
all
on.
you have
Hey,
to do
let's
is
take
send
mask
us a
off.
text.
yeah, and we really want to avoid that anyway, the back and forth, because it just makes it really hard for parents, it makes it hard for students, and it makes it hard for enforcement with staff. When you're bouncing back and forth between masked and optional and required.
Plus, I mean, you got this new variant that's like the common cold, so they're saying. So we're gonna be quarantining people for the common cold now? I mean, as of now, supposedly it hasn't killed anybody, but it's spreading.
But yeah, my common cold has nearly killed me in the last few
Yeah.
days.
Make sure you say.
Well, the one they
mic
call
that you're
Omicron or
COVID
whatever,
negative.
supposedly it's spreading like wildfire, but it hasn't killed anybody. So, I mean, are we gonna be treating that the same? I mean, when it's the common cold basically, as of right now, could change. But, I mean,
Under guidelines, yes, but it's still considered a COVID.
a harmless COVID strain. But
But there were
Still,
COVID
it
viruses
doesn't matter, by
before,
definition, it is a
Alpha.
COVID
or coronavirus.
virus.
yeah. I mean, that looks like the next one that's coming.
What about if for January, we did do what you're suggesting and do the 10% and see how that goes for that month? And then if this variant is more like the common cold and really not a big deal after we see more of it and what it's going to do, then February, make a different decision.
I just hate to put that on them, but
But its numbers are already.
But it's not
tracked.
hard.
It's not hard.
I know, but they could
Do you
change the
hate
rules
that, Joe
every
Farrell?
other day based on.
Well, no, nobody's
Wouldn't
changing the
change.
quarantine rules anymore because we set them at that, with that last policy. Unless they just come out with some crazy, if you're in the building, you have to be quarantined if somebody has COVID. We've got, our rules now are pretty cemented on who should be getting quarantined. That's not saying that staff may or may not be following it correctly, but that's who should or should not be being quarantined at this point.
The more black and white you give staff, the better. So if you said 10% or 15% or 20, whatever you decided, if we have that number, that's black and white for us. When it reaches that, we're there and we do an announcement for that school due to a rise in quarantines and COVID positive cases potentially that we're going to implement masks, required for a 2-week period. It doesn't eliminate the back and forth, but it does give us it gives us a clear line.
And kind of like some baby steps to get back to normal.
So
Would
do I
you
need to
wanna punch us in the
amend,
face if we did that?
do I need to amend that motion with the threshold?
You guys wanna punch
If
us
you
in
want
the
to
face?
include that threshold, yes, you can make a motion to amend your motion. Get a second on that, then vote on the amended motion.
Okay. Do I need to rescind that first motion or just,
Or you can do that too.
Okay.
You can, actually, that would be easier if you withdrew your motion.
all right, so I withdraw that motion.
Thanks.
Yep.
Would you say that, Bob?
I would let the holidays evolve. The reason I was saying the 14 days is because if something were to blow up, somebody, a concerned parent, or citizen, or whatever, couldn't say that it was a direct action that the school board took, because that gives you the 15 days, 14 days to see how things go after the holidays, see how that goes. If everything breaks, then you've got a sound basis for a very solid decision to move forward and say if it's 5% is your threshold, you get a 5% positive rate or whatever. 10% is double what the recommendation is. Just if you said a 5% threshold of positive across the entire school district, and you said it after 14 days, then you've done everything you can do. We've waited, we've looked at everything post 14 days after the holidays. This is what the metrics look like, and we feel like we can make a sound decision. You don't want things to blow up on day 4 or day 5, and then mom and dad are down here screaming at you. Well, they got it when they were at home, when they went to Walmart or Aunt Mary's house or whatever. But the metrics or the optics of it look like it's something you did because they're already back in school. So I just throw that out there for your consideration. If you let those 14 days pass, everything's already happened. Everything's already back into the flow. Everybody's back into the system of whatever they're doing. And then you've got a very sound basis, because then if it blows up on the 20th or 25th, wasn't anything directly that you did. It was a matter of your flow's been in place for 2 weeks. It's just community spread.
So by that logic, you're saying that the uptick in the curve would happen on the 25th, 2 weeks after we return to school, or?
If something were to blow up because of being back into school, it would be happening in the first 14 days. If it was just simply the premise of everybody jumping back into the school system, you would have that. You would already be seeing that.
But it isn't,
Those 14 days.
isn't a lot of the community spread within the home? So, couldn't you say, or wouldn't you predict that by the kids actually taking a Christmas break and everybody's home, everybody's in one house, spending a lot of time together and multiple families gathering in tight quarters, that's already going to cause the uptick in cases that we would see? So December 25th to January 5th, that uptick would already start when we return to school.
From the family spread, yes, sir. By the same token, that's what I'm trying to explain to you. When you have the kids come back into school, you don't want mom and dad coming to you saying, why did you do this? What were you thinking? You want them to have 14 days of continuity. Everybody's back into their normal process. Everybody's back into their normal routine. Because if you do it the way you're proposing, then when they did get sick with Aunt Mary and everybody on top of everybody, then they're gonna present to school on day 4, day 5, day 10, whatever it is. And then it's gonna look like, well, the schools went away from their policy and this is what's happened and it's blown up. I'm just telling you what the optics, the path where you would have shown that you demonstrated all your due diligence would be. That's why I was promoting the 14 days, because then there's no argument there. Everybody's back in their routine, everybody's circulating the classes, everybody's doing their normal thing. If it's gonna blow up, it's gonna blow up, to your point, whether they're in school or in Walmart. But if you've done the same, but if you've done your due diligence, and you've done all you can do as a school board, because again, my example with the football games in the schools.
Right.
You play by one set of rules at the football game and another set of rules at the schools. This allows everything to be on an even playing field. Day 14, that's blown up. The world had to end.
That's the underlying point behind a lot of this, is that you walk out of the school system and mask comes off, you do what you want to at the football game, basketball game, volleyball game, at home, at the friend's house, you know. We're trying to control just a small portion.
Trying to control 8 hours of a day.
Yeah, control 8 hours a day when the same kids get out of the classroom and go ride the car together and go wherever. And it feels like we always get to the point where, hey, numbers are coming down, let's make the mask optional. Oh, well, the numbers are going back up, let's put the mask back on. It's like there's just never a good time to make that delineation.
We come back from spring break, we know, just in general, we know the cases are going to go up. Quarantines are going to go up because it happens after every major holiday period. Well, we do the 14 days before we make mass optional. Well, during that 14 days, day 4, day 7, day 10, we get a spike in cases, a spike in quarantines. Then we just have to extend another 14 days to let that settle down. And that's what we've been fighting all year, is we've been pushing and pushing and pushing and pushing. And we never get to the point where we just stop and say, put it on the parents. If they want their kids masked, they can wear it. If they don't, they don't. And if they don't and they get quarantined, they understand why it happened.
And that's my perspective, is called a libertarian view, but, you know, as a parent, let me decide if my child's at risk or not. Let me decide if my child needs to wear a mask at school. Yeah, I accept the responsibility if I send my child to school without a mask and they need to be quarantined for 14 days. That's a choice.
I agree with you completely on that front. I'm just saying, as from a liability and being an elected official governed with tasked with the responsibility of protecting children, I personally would recommend waiting for 14 days so you would have a solid basis of, and to your point, Mr. Purcell, yeah, you probably will see a couple of folks trying to straggle back in or whatever, being sick or whatnot. But if you set that finite date, we're going to look at this. If things are flat to level, we're going to move forward with this. You set up a true matrix. You don't have to move the goalposts. Please don't move the goalposts. But I'm just saying that 10 days can make a huge difference in the optics of the situation. You're still going to have your same end goal, but you're showing that you made your decision based on proven science and epidemiology, and you made a sound reason for it, other than just saying the day we come back. That's all I'm saying about the 14 days. It just gives you that basis. And again, that's your call. Barbie, it is not my call. I'm just saying from the public health perspective, I would encourage you to build that 14 days in there so you would have that cushion. So then you can say, okay, if February 5th it blows up, I'm saying things are going to go up and down, up and down, up and down. But it wasn't anything the school system did. This is things that are happening out in the community, and those kinds of things. I mean, flu strains, flu cases for A right now are through the roof. But is that just because we're testing more? Is that because everybody was hiding under a rock this time last year? I mean, so you've got to take things and put them in perspective. And I would just say that the 14 days would give you that basis so you could defend it if something did happen.
Again, I would like to wait till our meeting in January. I get what you're saying, and I completely agree with you that this has got to stop sometime. But I do agree with Battle on that. From a medical perspective and what I see, I think,
It comes back to me, cases versus quarantines.
yeah, I got you.
If you had a belief that the mask in school were going to make a difference as far as case numbers, it's probably going to be minuscule, because I don't know that any of our in-school exposures have turned into actual cases, especially unless the same children who were exposed in class were also the same kids hanging out after school. So, I mean, that's what it's, all about, is trying to keep quarantine numbers down, because I don't have a lot of faith that we're actually going to affect the COVID cases with our policy.
I mean, it's a compromise. You're not gonna get the full 14 days, but you'll get some days.
Well, if we meet on the 13th,
Yeah, just like,
Martin Luther King Jr. Day is the 17th, so we're already out of school anyway.
I'll see you what.
Can you answer, what's the average incubation period, or from the time somebody's exposed right now until the time somebody shows symptoms? Is it still about 5 or 6 days? Less, about a week, maybe?
We tell people not to even test until at least day 4 or 5, just because it takes that long to really have a strong enough, not to be gross, but when you're scratching that little card, it takes that long to get you a good reaction, so you'll be able to see what the actual
The juicy
result
specimen.
is. So really, any time in that, the closer you get to 14 days, the better you are. That sweet spot, and again, I can't sit here and tell you exactly that's what, but that sweet spot's probably between day 4 and 10-ish, that you should be able to start to see something. Again, everybody reacts a little differently, so they may not be symptomatic, and that kind of thing.
We return on the 5th and have a meeting on the 13th, and Martin Luther King holiday is the 17th. Then the 18th is that 14th day.
So that was
14th day anyway.
That's the 14th day. After we return from break.
Do you see any situation where we're going to decide in January, outside of a mass infection, it's hitting schools and we're down?
It's only 3 days of school, right? That Wednesday, Thursday, Friday? No.
We have Wednesday, Thursday, Friday, and then we have the full next week before the holiday.
7 days of school.
Eight.
Be 7 days of school before our meeting.
Before the meeting, yes.
It's
And
8 days of
school
mask
days
wearing.
before we would. And you rescind
Seven.
your motion to make it for the
Well,
18th.
Wednesday,
When we revisit it.
the next
Wednesday, Thursday, Friday,
Tuesday,
Monday, Tuesday, Wednesday, Thursday,
My
Saturday.
concern is if we come to the January meeting
No,
and
before our
it's
meeting.
done what we expected to do, which is there's gonna be cases and rise, and then everybody's freaking out, and they're like, oh, let's push it another 2 weeks. That's my concern with waiting until the January meeting.
That's the same question I've
Because we
asked
know we're
multiple
gonna see it.
times.
I mean, everybody across the country knows they're going to see an increase when everybody comes back from Christmas vacation.
An increase of what?
I don't know. I don't know if we're seeing an increase in anything.
Have y'all gotten any new guidance on like, if, say there was a harmless COVID variant, like Omicron? Look, I don't know that it is, we don't know, but it looks like it. Are we still gonna have to quarantine people if it's a harmless variant going around?
Well, we moved to a syndromic surveillance. I think that to me is again why I think is really the stars are lined up great if we can get to that 15, 14 days after the kids return back. Because I think we're always, Mr. Brazil, you're right, I think we're always gonna have some prevalence. COVID is not new. I mean, H1N1, SARS, MERS, all the different things we've had over the years. It's just another variant. This is obviously much more, don't get me wrong, much more aggressive, much more harmful to a pandemic extent, don't get me wrong. But we're always going to have some prevalence of coronavirus in our communities. So if we can get to the point where we know we have a stable level, whatever that number is, like I said, we're vacillating between 200 and 250. Is that good? Is that bad? I guess it's all a matter of perspective. But I'm saying if we're still flat and we've gone through whatever that number is, we're going to have cases, but we've gone through Thanksgiving, Christmas, New Year's, and post 14 days past school, and we're still flat, you know, all the naysayers and all that, they can't point fingers at anything anymore because we've gone through, you know, 4 major events of crowding and interacting and all of those kinds of things. So if something's gonna happen, it's gonna happen. But you as a board have done everything you can do within your power to get to that point. So it's not moving the goal line. I think it's just if things are flat, then, you know, it should be golden. Now, if cases are 500 or 1,000 or 1,500, then obviously, you know, there probably need to be some kind of other discussion, but it doesn't appear that knock on wood, it doesn't appear that's going to be the case.
I could go either way, I guess. I understand where Sissy wants to. I mean, I don't, you're asking, what she's asking for is going to wear a mask for 8 days. So it's like,
So how about we go ahead and make the policy, we change the policy today for the 18th, which would be the day after coming back from MLK. And then at next month's meeting, we have to revisit it, but unless there's been some drastic change, it's going to be to keep the policy that was already decided. That way parents know there's an end coming. That's my biggest, is they're constantly asking, what is our end game, as you say? They don't know, because we don't know. There's no answer given by the state other than you have to be in green, and we know that's unreachable for this county because of the population. So I think setting a date gives them.
And that's why I kind of would go back to the threshold for the schools, just because when we come back for our meeting in January and we have, you know, 10 cases at each school or whatever, you know, it's gonna be like, oh, whoops, never mind.
we're going to meet again before the
False
18th.
I know, but I'm just saying, when we meet again, and if cases are elevated, we will move I feel
Because
like-
it meets that threshold if we come up with a 10% quarantine rate, which can be done at any time, though, if we have to. But if everybody's wearing the masks, with the double mask policy and the asymptomatic policy, there shouldn't be that much quarantine. I mean, we've seen drastic reduction, and it's holding steady in the single digits for every school since that's been in place.
There's so many variables. I mean,
But
I just
even
want the
cases
parents to have
are
an end
high,
goal.
Yeah, and I
They're
agree.
tired
I
of
agree with
hearing
you.
next month.
I agree with you
They
completely.
want to know that we're going to make a concrete decision on stopping the mandate and putting it back to optional on some day.
see, I don't like the 10% or whatever rule because, like, what if it is a harmless COVID? What if it is? What if I'm
It doesn't matter whether we think it's harmless or not, it's gonna be whatever.
What's our rule? If we put 10% in,
Yeah,
we could just not put the 10% in there.
until it stopped being tested for
All right.
and getting labeled as COVID.
And I know Delta's dangerous, we all know that. But the next, maybe we've got through that. The next one may be this Omicron mess, and if we come back to that, but it is harmless. I hate to quarantine a bunch of people and on a threshold.
Well, I think that we can look at it then, you know, if you see
Yeah.
that that's the variant that keeps turning up, you
Well,
know, and
all
people aren't
Dr.
getting
Banks
sick and the
is-
hospitals aren't bursting at the seams,
Right.
then I think that's a reasonable thing to consider.
All his
Um,
recommendation, though, is 10% of the school population is quarantined. If they are following, especially for those first 14 days returning, they're both wearing masks. They're wearing a mask and they're asymptomatic. I don't think we're going to get into that quarantine being a major. We're not going to be quarantining a bunch of people. If they're wearing masks like they're supposed to, they don't have to quarantine.
I know that. I'm talking about I'm just saying I don't like the 10% thing. On the 18th, after the 18th.
Well, that's only if we get to 10%. That's not, I'm a little confused. He's saying that if we end up quarantining 10% of the school population, we go back to masks until we get it brought back down.
Right, I just don't want to make it automatic.
What's the difference? I mean, you're making it automatic for everybody or not? It's the same difference.
The difference to me is it Delta or is it the common cold?
That's
That's the difference.
But that's the part that's
So
going
we don't have that distinction. It's either
And
they
again,
they
you
were
have a
exposed or
month,
they
you
weren't,
have a
and they were
month to
symptomatic or
ride
they're
that
not.
out and look at it
Yeah.
and see what it looks like when we come back.
How about we set the date for January and we revisit the 10% guidance at next month's meeting. So if we have to
You
discuss
always
it.
gotta be hardy, you gotta be hardy.
Mr. Chair,
Yes, sir.
care to share your opinion?
You're mighty quiet.
Y'all are having a lot of great conversation. My opinion is, go towards a total mask optional mandate, or total mask optional on their return to school January 18th after. That gives a few days of school. We know that our masking policy has kept quarantines at a very low level compared to our positives. And I just feel like from my standpoint, we've done our due diligence to keep quarantines coming off a long break of school at a very low level. And then we also given our student population, our parents, a start date of mask optional across the board. It's my opinion.
Is your motion on the floor?
But there is a motion on the floor with a second to make mask optional at the return of Christmas break on January 5th.
Now, can I make a motion
Just 8 days,
for the 18th? Now?
All right, so before I withdraw and make another motion, everybody's pretty comfortable with January the 18th,
Yeah, I think everybody.
with the threshold as of the 18th.
I don't like automatics, but
You're a math guy, come on.
I just don't like automatics because we don't know what it is. If we
That's
get-
right,
I don't
but
want
it gives you a
code.
month to learn what it
Yeah.
is.
But let me ask you a question. When they test, when you get a coronavirus test, does it tell you what variant it is?
So
Yeah, that's a
only
separate
when they
lab.
do
Not
like
until,
the
yeah,
PCR, right?
much
When
later.
they do the PCR and send it to the state lab. And so am I under the right understanding that all of the PCRs that get sent, they're the ones that get looked at, and that's where those numbers come from?
99% are Delta right now.
Mhm.
99% are Delta. There is Omicron there is Omicron out there.
But not many.
It just hasn't been actually flagged yet. Because again, things mutate every time you come from one person to the next. But you're right, you got the PCRs, they're drilling down and they're looking at, trying to see if this Delta, is it Omicron, is it whichever variant.
So if you guys do know what the difference is between a rapid and a PCR, so, okay.
So, yeah,
Good?
We're gonna meet again before.
The 13th, yeah.
So it's fine.
but this way we get that date out there, parents can know that it's coming.
So let's withdraw. Did I actually make that
Yep.
with the threshold?
Without
Without the threshold, okay. So make a motion to make mask optional as of January the 18th, correct? With a 10% threshold for individual schools of quarantine levels.
To
I
require.
guess you need to say round to the highest number of 10% in case there's a decimal point there, but to be specific.
Okay.
Because I'm sure it'll be asked, what if there's 10.4 kids?
Yes, that will be asked. Yes, sir.
So round
Banks
up.
is gonna ask it.
Round up.
Did the first motion die? Did you?
I withdrew that.
You withdrew, okay, I didn't hear you withdrew, sorry, my apologies.
All right, so Dr. Banks has withdrawn his previous motion that had been properly seconded on the floor, so it is truck. Dr. Banks has made a new motion that we make mask optional. Camden County Schools as of January 18th, 2022, with the condition of a 10% threshold of quarantine rates will make the mask mandatory in that particular school building. Fractions will be rounded up for clarification. Is that motion correct?
Sound accurate.
All right.
Second.
Seconded by Mr. Purcell. Is there any further discussion?
I do have one observation, Mr. Chair, and that is that the January meeting, which will precede the effective date of this modification of the policy, the board will still need to revisit the current policy, and at that point, you can make additional changes to effectuate it immediately or to delay that kind of change. You can just wait and see, but you will need to revisit the policy at that point still.
Because it's been more than a month.
Yes, sir.
Mhm.
And it has to be visited monthly.
Yeah, every calendar month. you have to do it.
Okay.
Any further discussion? Thank you for those comments, Dr. Light. It should be Dr. Light. All those in favor say aye.
Aye.
Opposed? Motion carries. All right. Superintendent's recommendations from closed session.
Yes, it's my recommendation that you approve the personnel report as presented by Ms. Anderson in closed session.
Motion.
Motion by Ms. Islet to accept her superintendent's recommendation for personnel as presented by Ms. Anderson in closed session.
Second.
Seconded by Mr. Purcell. Is there any further discussion? All in favor say aye.
Aye.
Opposed? Motion carried. Thank you. Board of Education will have their holiday gathering today at 11:30 at Cypress Creek Grill. Is there any other future agenda items that anyone would like to see? Seeing none, I entertain a motion that we return to closed session.
Motion.
Motion by Ms. Idlet, seconded by Mr. Purcell, that we return to closed session. All in favor say aye. Opposed? We're in closed session. Thank you everyone for attending. Hope you have a wonderful Christmas break. Merry Christmas.